Runner's knee earned its nickname because of how frequently it strikes a public type of athlete, but you don't have to pin on a race beep or do laps around a track to develop this knee pain. In fact, runner's knee, technically called patellofemoral pain syndrome, is pretty common, with healthcare providers saying it accounts for as many as 17% of all doctors' visits. Today, we will be discussing about runner's knee, its causes, symptoms, and treatment. Kindly subscribe, hit the notification bell, and make sure you stay until the end of the video as we will be taking an insight into runner's knee, its causes, symptoms, and treatment. Let's get started. Runner's knee, popularly called patellofemoral pain syndrome, is a common overuse injury causing pain at the front of the knee, around or behind the kneecap. It is most common in runners but can also affect other people who participate in sports such as cycling and hiking. Most people recover completely from runner's knee after a few months of rehab, although it is an injury that can become chronic if not treated correctly. Causes of runner's knee. The knee pain occurs as a result of problems between the kneecap and the femur. The pain is observed in the front of the knee and comes on gradually. Pain may worsen with sitting, excessive use, or climbing and descending stairs. Often, the pain is usually initiated when weight is put on the knee extensor mechanism, such as when ascending or descending stairs or slopes, squatting, kneeling, cycling, or running. Pain during prolonged sitting is sometimes termed the movie sign or theater sign because individuals might experience pain while watching a film or similar activity. It is important to note that no actual tissue damage is associated with runner's knee pain. Unlike many other sporting injuries, no bones are broken, no tendons are torn, and no cartilage is damaged. Instead, the pain you feel is coming from inflamed tissues that surround the kneecap, particularly fat, bursa, and synovial membrane. These tissues work to lubricate the knee joint and provide extra cushioning between the bones. When there is an unusually high stress level on the knees, these tissues get irritated and inflamed. This inflammation acts as a warning or potentially more severe tissue damage if the stress continues. Every tissue in the body, bone, cartilage, fat, tendon, muscle, etc. has a certain level of stress that it's used to handle. The stress tolerance develops over many years and is determined by your lifestyle, what your body needs to do on a regular basis. Professional athletes, for example, develop a much higher tolerance for respective physical stress than sedentary office workers because they condition their bodies to handle intense amounts of exercise. Overuse injuries like runner's knee occur when respectively high levels of stress are placed on a joint that goes beyond what those tissues have adapted to handle. For most people, getting runner's knee is simply a sign that they need to slow down their training and better prepare their body to handle the stress of long-distance running. Runner's knee is an overuse injury caused by doing too much too soon. It's a sign that your body wasn't ready for that much running. Many other conditions can cause knee pain, and some feel similar to the runner's knee. This includes small cracks on the kneecap, called stress fractures, tendonitis, torn ligaments, cysts, and arthritis. Some people, especially older folks, can have arthritis and a runner's knee at the same time. Symptoms. The onset of the condition is usually gradual, although some cases may appear suddenly following trauma. The most common symptom is diffuse vague pain around the kneecap and localized pain focused behind the kneecap. Affected individuals typically have difficulty describing the location of the pain. They may place their hands over the anterior patella or describe a circle around the patella. This is often called the cycle sign. There is no single test that pinpoints patellofemoral pain syndrome. Sometimes, your doctor can diagnose it by asking you about your symptoms, examining you, and watching your knees as you perform movement like one-legged squats. In other cases, he or she may order X-rays, an MRI, and other imaging tests to rule out other knee injuries or conditions. One of the most common myths about runner's knee is that it happens because of kneecap maltracking, an idea that the kneecap moves out of alignment and rubs against the tibia bone of the shin. For a long time, doctors and physiotherapists believed this bone-on-bone rubbing caused the pain and wore down cartilage. However, we now have a lot of evidence to show this isn't the case and that bad knee alignment does not cause runner's knee. People have kneecaps of different shapes and sizes. It is common for kneecaps to move at slightly different angles as the knee bends. We now see that these anatomical variations are not a fault in some people but rather normal human structure. Research studies have proven that people who have less than ideal alignment, who we could have expected would get runner's knee, are no more likely to develop the injury than people who have textbook perfect knees. Treatment for runner's knee. The most effective treatment for runner's knee is exercise rehabilitation. Strengthening the hip and knee muscles is proven to significantly reduce pain and improve function, allowing runners to return to normal physical activity within 6 to 12 weeks of treatment. For mild cases of knee pain and swelling, you can try self-care and home treatment. Ice, anti-inflammatory medications like ibuprofen or naproxen, and cutting back on activities that cause knee pain can help. Some people use tape or knee braces, but studies suggest this works best when combining them with exercise programs. To learn how to use ice bath to treat runner's knees and other injuries, click the link showing on your screen. A study released in 2016 also showed that 73% of runners who completed a course of exercise rehabilitation remained pain-free 3 years after their initial injury. An exercise rehabilitation program should focus on hip and knee exercises, as well as core strength and balance. Exercise should be performed 2 to 3 times per week, with a gradual progression in difficulty. There is some promising research to suggest that foot orthotics can be effective in reducing the pain of a runner's knee. K-tape, sports tape, and knee braces can help relieve knee pain while running. These modalities work by offloading some of the stress on the knee. There's a good option for runners who are racing or training with mild runner's knee. However, tapes and braces do not access the cause of the injury and are therefore not long-term solutions. To prevent a runner's knee, you should stay in shape by ensuring your overall health and conditioning are good. If you're overweight, speak to your doctor about creating a weight loss plan. Do a 5-minute warm-up, followed by stretching exercises before running or performing any activity that stresses the knee. Your doctor can show you exercises to increase your knee's flexibility and to prevent irritation. Never abruptly increase the intensity of your workout. Instead, make changes incrementally. Buy quality shoes with good shock absorption and make sure they fit properly and comfortably. Don't run in shoes that are too worn. Wear orthotics if you have flat feet. Keep a tight core to prevent yourself from leaning too far forward or backward, and keep your knees bent. Try to run on a soft, smooth surface. Avoid running on concrete. Walk or run in a zigzag pattern when going down a steep incline. People heal at different rates. Your recovery time depends on your body and your injury. While you get better, you need to take it easy on your knee. That doesn't mean you have to give up exercise. Just try something new that won't hurt your joints. If you're a jogger, swim laps in pool instead. Whatever you do, don't rush things. If you try to get back on your workout before you're healed, you can damage that joint for good. Don't return to your old level of physical activity until you can fully bend and straighten your knee without pain. You feel no pain in your knee when you walk, jog, sprint or jump, and your knee is as strong as your uninjured knee. And that's it. We've come to the end of today's video. Let us know your thoughts about runner's knee down in the comments. Also, make sure to leave a like on this video and subscribe to the channel if you're new. Thanks for watching. See you on our next one. This video is brought to you by Runners Athletics, makers of the best running sunglasses for men and women. UV 400, polarized anti-fog, ultra lightweight and equipped with spring flex hinges. These sunglasses will race past the finish line while most others fall short. Gear up for your next adventure at runnersathletics.com.